Obsessive compulsive disorder, also referred to as OCD, isn't just about liking cleanliness or organizing things. It's about living with thoughts that keep coming back and simply won't stop. And the most important thing, OCD is not a personality flaw or a habit, but a treatable medical condition. Having OCD doesn't mean you're weak. It's a brain disorder that is manageable with the right treatment. Science shows that the brain can be retrained and you can take back control. If you or someone you know struggling with OCD, remember, you are not alone, and this condition is treatable. Hello, I'm Dr. Syeda Quadri, a U.S. board-certified psychiatrist, and I've been working in the mental health field for over 15 years. Today, we'll understand how OCD affects the brain and how ERP therapy, brain stimulation, mindfulness, and structured routines can help in recovery. So let's get started. OCD changes the brain's thought process. So OCD is like a mental loop that just won't stop. Research shows that OCD makes the brain's error detection system, which is the orbitofrontal cortex and anterior cingulate cortex, overactive. This makes the brain repeatedly signal that something is wrong, even when everything is fine. That's why people with OCD check the door repeatedly, wash their hands over and over again, or arrange objects in a specific manner, even when they know everything is already okay. So, the good thing is the brain's wiring system isn't permanent. With the right therapy and techniques, it can be reset. The most powerful treatment for OCD is ERP therapy. Facing your fears changes the brain more than avoiding them. Exposure and response prevention, also referred to as ERP, is the most effective and globally recommended treatment for OCD. In this therapy, you are gradually exposed to your fears without performing the compulsive action. So this process teaches the brain that uncertainty and discomfort can be tolerated without resorting to compulsions. For example, someone with a contamination fear might be asked to touch a dirty surface and then be stopped from washing their hands right away. And yes, aside from ERP, there are also newer therapies showing promising results. Brain stimulation and psychedelic therapy. When traditional therapy works less effectively, science takes the next step. Repetitive transcranial magnetic stimulation, also called rTMS, is a non-invasive technique that calms overactive brain circuits and helps normalize activity patterns. This is an FDA-approved procedure and results are promising. In addition, controlled psychedelic therapy, such as psilocybin under strict medical supervision, is showing promising results in research because it can help reset the brain's rigid patterns. Clinical trials have shown that when psilocybin sessions are combined with psychotherapy, symptoms can improve long term. But no matter what treatment you're using, daily habits play a huge role in recovery. Mindfulness, journaling, and structured routines. When you take control of your attention and time, OCD gets weaker. Harvard research shows that mindfulness meditation reduces the intensity of obsessive thoughts by anchoring the mind in the present moment. Journaling helps take intrusive thoughts out of the mind and reduce their emotional overload. And structured routines like fixed meal times, regular exercise, and set work hours reduce uncertainty and help control compulsions. When the brain knows the flow of the day, anxiety naturally goes down. And one thing that locks in recovery is consistency. Consistency is a path to long-term freedom. Recovery doesn't happen in one day. It's the result of small daily steps, whether it's ERP, rTMS, or mindfulness. Consistent practice is what creates new healthy patterns in the brain. If there are too many breaks, old compulsive habits can return. Even 10 minutes of mindfulness a day or one ERP exercise a day can keep your progress strong and reduce the chances of relapse. In conclusion, OCD is completely treatable. With the right therapy, tools, and healthy habits, you can retrain your brain and live a balanced, happy life. If this video was helpful for you, please like it and share it with someone who's dealing with OCD. Write in the comments which step you will try first in your life. And don't forget to subscribe so you always get simple, science-backed mental health tips.